Hello, in this video, I'm going to talk about separated shoulder. So what is a separated shoulder? So first, I want to clarify that it is an entirely different injury from a dislocated shoulder. So a dislocated shoulder, we are referring to the glenohumeral joint, that is the ball and socket joint of the shoulder. In a separated shoulder, we are referring to the acromioclavicular joint, the AC joint. So a separated shoulder is an injury to that AC joint up on the top kind of tip of your shoulder. Can include sprain or tear of the acromioclavicular ligament or the coracoclavicular ligaments, either or both. Usually it includes the AC ligament, and in more severe separations, it can also include the CC ligament. So in either case, a separated shoulder causes instability, and it can even lead to dislocation of the AC joint depending on the severity. So signs and symptoms. So at rest without movement or anything, any special position or anything like that, there's usually pain over the superior anterior shoulder. So meaning the top and maybe a little bit to the front of the shoulder. It also can radiate, and there can be pain in the anterolateral neck. So anterior meaning front, lateral side. So kind of on the side to the lateral, the lateral kind of front of the neck. And then also the anterolateral deltoid. So deltoid meaning the shoulder muscle, this big muscle on the cap of your shoulder. So pain towards the outside or towards the front of the deltoid muscle. Then when it comes to pain caused by movement, there's pain with most movements of the shoulder complex. So most movement of the shoulder is going to require movement of the AC joint, which is painful. But it will especially be painful if we abduct, so we lift the arm out to the side, or flex, lifting the arm up in front, and we get to above 90 degrees of either one. So at 90 degrees, we require sort of special movement of the AC joint and the glenohumeral joint to allow for that motion. And so it gets especially painful above 90 degrees in both of those directions. Then there will also be pain with passive and active horizontal adduction. So horizontal adduction would look like this. So here's my shoulder. If I move my arm across the front of my body, that is horizontal adduction. Passive meaning that someone is moving it for you, and active meaning that you are moving it yourself. So there will be pain, whether it's passive or active in that motion, and especially at end range, meaning the further you get, the more it will hurt because it will put compression on that joint. In severe cases, there can be a noticeable deformity. So there can be a noticeable, visibly noticeable displacement like we see in the picture here, because in that case, there's an actual dislocation. So there's a displacement of the clavicle from the acromion process. All right, so the injury mechanism, how does an shoulder separation usually happen? Most commonly, it's a direct fall on the acromion with the arm at its side. So like if your arm is at your side and you fall, maybe you do a tuck and roll or whatever, but you kind of fall and land on the side of your shoulder with your arm at your side, that's the most common cause of this type of injury. Happens in football, all sorts of different sports, can happen in car accidents. And in that case, it wouldn't be a fall, but it could be an impact directly on the acromion. It also can happen indirectly. So an indirect injury mechanism, where like if you fall on an outstretched arm, so like you put your arm out to catch you when you're falling, but that indirect force where you're not putting force directly from an impact on the joint, but the force is going on through your arm and being transmitted through that joint, that can also cause a separated shoulder, or really any other direct impact to the AC joint. All right, so severity. When it comes to AC separations, we use the Rockwood classification of AC separation. So this is a way to classify the injury and the severity based on what exactly is injured and to what extent. So a type 1 would be that the joint is still in place, but there's a mild sprain of the AC ligaments. That's the most mild. Then a little bit worse, type 2, would be that we rupture the AC ligament and sprain the coracoclavicular ligaments. Type 3 would include a superior dislocation. So not only a rupture of all the ligaments and the joint and capsule, but it would also include a superior dislocation. So it dislocates in the superior upward direction. Now, a type 3 means that that superior dislocation is no more than 25% displaced compared to the uninjured side. Now, that's important because when we get to type 5, you'll see that that's also a superior dislocation, but it's more severe. Okay, so type 4, same as type 3, meaning that everything's ruptured and there's a dislocation, but in that case, it's a posterior dislocation. So it dislocates in the posterior direction. Type 5, same as type 3. But again, like I just said, in this case, it's a superior dislocation, but we call it a gross superior dislocation to indicate that it's worse. It's a lot worse. There's a lot more displacement. So that's how we would rate it if the difference is more than 25% compared to the uninjured side. Then finally, a type 6, again, same thing. Everything's ruptured. There's a dislocation, but in that case, it's an inferior dislocation. So it dislocates in the inferior or downward direction. So treatment and healing. Most cases of separated shoulders heal within 2 to 12 weeks, just depending on what type it was. So how severe was the injury? So most cases will heal without surgery in just a variable amount of time, depending on how bad it was. You might need to use a sling to help take the weight of your arm off of the AC joint, so it helps keep it in place. And then standard RICE protocol, so like rest, ice, compression, elevation. You also might need to take anti-inflammatory medications to help with the inflammation or pain relievers because it is painful. And then physical therapy and or exercise might be prescribed when the healing has progressed enough to allow for it. So you don't want to jump into that too quickly before you're ready. But your doctor will help guide that process. So you should seek medical attention for this type of injury. You should get the advice and diagnosis of your doctor. And then as it's continuing to heal, at some point, it will be appropriate to start physical therapy or to start doing certain exercises to strengthen the muscles and ligaments to further improve the healing. You're also going to need to avoid lifting heavy objects for quite a while, even after it is finished healing, because it will still be vulnerable for some time after it is technically healed. So you'll need to take it easy with that for a while so that you don't cause a re-injury of the same joint. More severe cases might require surgery. So there's a few things that they might do for surgery. They can shave the end of the clavicle if there's a problem with rubbing against the scapula, so they might kind of reshape the ends of the bones. But more commonly, they'll repair the torn ligaments because that's really what caused this problem in the first place. And then if there's not enough of the ligaments that are still intact, then it might require a graft and reconstruction of the torn ligaments. Okay, but again, most cases heal without surgery, and surgery is a last resort if it's severe enough or if you're not healing well enough, there's still pain and dysfunction past the point where it should have healed. All right, thank you so much for watching this video, and I hope you have a great day.